So properties of a test. See this slide, important. Properties of a test. For example, I am telling, according to gold standard test, see my words properly. According to gold standard test, for example, if I am having 100 deceased individuals, out of 100, 80 are detected correctly. So how many true positives? Answer my question. Out of 100, 80 are detected correctly. How many true positives in the question? Answer my question. Total 100 deceased. Total 100 deceased. 80 are detected correctly. How many true positives? 80. So sensitivity is 80%. Sensitivity is 80%. Out of 100, 80%. 80%. So remaining 20, even though they are having disease, they are not detected. Even though they are having disease, they are not detected. So they will become false negatives for this test. If sensitivity is 80%, how many false negatives will happen? Answer my next question. If sensitivity is 80%, how many false negatives will happen? 20%. So therefore, if sensitivity is increasing, false negatives will decrease. True or false? Next question. If sensitivity is increasing, false negatives will decrease. True or false? See the words properly. Good. Sensitivity is increasing, false negatives will decrease. Means there is one more test which is better than this. True statement. Good. For example, I am telling, out of 200 normal individuals, 100 are detected as normal. So how many true negatives in the example? Answer my question. Out of 200 normal individuals, 100 are detected as normal. How many true negatives in the example? How many true negatives in the example? 100. So what is specificity of a test? Out of 200, 100 are detected correctly. What is specificity of this test? How much? 50%. Specificity is 50%. So ability of a test to detect true negatives is specificity. Ability of a test to detect true negatives is specificity. So out of 200, if 100 are detected, how many are taken as positives? By mistake, false positives? Remaining 50%. Remaining 50%. So a high specific test will have less false positive results. True or false? Answer my next question. A high specific test will have less false positive results. True or false? A high specific test will have less false positive results. True or false? True statement. Good. True statement. Now come to predictive values. See there, positive predictive value and negative predictive value. Example I am telling. Out of 160, example I am telling, out of 160 test positives, if 80 are having disease, example I am telling, out of 160 test positives, if 80 are having disease, what is positive predictive value? You can fill any number and you can discuss. There is nothing in this. Just example I am telling. Out of 160 test positives, 80 are having disease. Positive prediction of this test is very less, around 50%. Positive prediction is very less, around 50%. Means out of test positives, how many are having disease? Out of test positives, how many are having disease? Out of test positives, how many are having disease? In the same way, out of total test negatives, how many are normal? What is this? Out of, for example, I am telling out of 150, if 100 are normal. Out of total test negatives, if 100 are normal. Out of 150, if 100 are normal. What is this? Negative predictive value, which will help in exclusion. So diagnostic power of inclusion is PPV. What is diagnostic power of exclusion of a test? Answer my next question. What is diagnostic power of exclusion? See the words properly. What is diagnostic power of exclusion? What is diagnostic power of exclusion? Negative predictive value. Negative predictive value. So diagnostic power of inclusion is positive predictive value. Diagnostic power of exclusion is negative predictive value. So always remember, when you come like this, you'll get sensitivity and specificity. When you go in rows, you'll get PPV, NPV. You'll get PPV, NPV. And always keep in mind, if prevalence is increased, so chance of having disease will increase or decrease? Answer my next question. If there is high prevalent population, prevalence of disease is very high. If you are tested positive, chance of having disease will be more or less? If you are tested positive, if you are from high risk population, chance of having disease will be more or less? More means prevalence is increased, PPV will increase, NPV will decrease. So chance of inclusion is more, chance of exclusion is less. Tell me true or false. This is very important question. If prevalence is more, chance of having disease will be more, and chance of not having disease will be less. If you are doing HIV testing, always they will ask this question. The next question what you will ask is, what is your occupation? If the occupation is truck drivers or female sex workers, if the test results are positive, chance of having disease will be more. Chance of having disease will be more. Now tell me true or false. Listen. Predictive values will depend on prevalence of disease. True or false? Predictive values will depend on prevalence of disease. True or false? True statement. Yes. Chance of having disease will be more. Inclusion is more. Now coming to the difference between lead time and screening time. Lead time and screening time. So now there is disease onset. A, body cells are multiplying. Cells are multiplying in the body. Point B is where the patient will be detected. Patient is asymptomatic but can be detected. That is the first possible point of detection, that is screening. We call it as detection. Just remember now. If the patient is not identified, patient will come at this point with symptoms. Point D with symptoms. What is this point D called as? Answer my next question. This point D is diagnosis. Point D is diagnosis, where the patient will come with symptoms. Then there will be outcome. For example, point E is outcome. The gap between detection and diagnosis is known as, this is the advantage gained by screening. What is this gap called as? Answer my next question. The gap between detection and diagnosis called as, the gap between detection and diagnosis is known as lead profit. Lead time is an advantage gained by screening. Tell me true or false. Next question. Lead time is an advantage gained by screening. True or false? Lead time is an advantage gained by screening. True or false? True statement. Now what is that alphabet which is missing in the sequence now? What is that alphabet which is missing in the sequence? Tell me. If I am telling A, B, D, E, what is that alphabet which is missing in the sequence now? C. Final critical point. Final critical point. Always keep in mind, because if you do screening at this point, you can always change the natural history. From this point also you can change the natural history. But after this point, you cannot change the natural history. The sequence cannot be altered. That is why this point is called as final critical point. After this point, the disease course becomes irreversible. What is that point called as? Final critical point. That is why screening has to be done between what alphabets? Answer my question. In order to give advantage for the patient, screening has to be done between what alphabets? Between B and C. Between B and C. Then only there is an advantage for the patient. You can easily change the natural history. So screening time is between B and C. Always keep in mind. Screening time is between B and C. Screening time is between B and C. So don't make mistake between lead time and screening time. Screening time is decided based on one word, that is final critical point. After that, there is no advantage for the patient. After that, there is no advantage for the patient. Got it? Yes, good. Now come to the stats part, whatever is important for one shot session. See, one shot discussion is totally different. Every session what we do has its own purpose. That purpose has to be fulfilled. One shot is like crisp, rapid revision session. Now tell me, if the outlier is in the higher end, for example, I am telling, outlier is in the higher end. For example, I am telling RCB 1, 2, 2, 3, 4, 96. If some batsman, like for example Dinesh Karthik, 96 I am asking. 1, 2, 2, 3, 4, 96. Outlier is present in the data, true or false? And outlier is there in the higher end, true or false? Outlier is present in the data and outlier is in the higher end. Tell me true or false? True statement. Good. If the outlier is present in the higher end, mean will always be greater than median. Average score will become very high. Tell me true or false? Average score will become very high. Tell me true or false? True statement. Yes. What is this type of data when the outlier is in the higher end? when the outlier is in the higher end. What is this type of data? Very easy question I am asking. Outlier is in the higher end, where your tailing will be towards the right side. What is this type of data? What is this type of data called as? You can see the tail of the curve, no? It is going towards the right side. There is nothing in this, very simple. Right skewed data. Right skewed data, also called as positively skewed data. Positively skewed data. If the scenario is totally opposite, if everyone is scoring very good, suddenly RCB team improved 96, 96, 94, 93, 2 and 3. Just in dreams I am telling. Maybe this time it is completely dreams only. Sapna. Underline this word. Outlier is present in the higher end or lower end? See the words. Outlier is present in the higher end or lower end? Lower end. See this word. Lower ends. Very good. Because of this, if the outlier is present in the lower end, the data is shifting towards the negative side. Mean will become very less compared to median. Always mean will represent the tail of the curve. Tail is going towards right side or left side? Tail is going towards right side or left side? Tail is going towards right side or left side? Left side. That is why it is left skewed data. Negatively skewed data. Mean should not be used for skewed data. Always keep in mind. If you are using mean will give a wrong impression. Mean should not be preferred for skewed data because mean is affected by outliers. Mean is the most affected measure of central tendency. True or false? Simple words. It's very easy. There is nothing in this. Skewness means kis taraf. Yes, mean should not be used. That is why we have to use median. They will ask always this question. Which is the preferred measure of central tendency for skewed data? Answer my next question. What is the preferred measure of central tendency for skewed data? Median. You have to use median. Median will represent the data properly. You have to take the average and you can use the median. Median is preferred for skewed data, not mean. Mean is always affected by outliers. If you are scoring like this 1, 2, 2, 3, 4, 96, what you are doing? You are not doing anything. Only one student knows everything. Remaining all just writing simply Om Namaste Sir, Shri, Salam, Namaste. All these things you are writing. 1, 2, 2, 3, 4. Good morning sir, good afternoon sir. Like this you are writing in the answer sheet. Only one student knows and he is answering and he is writing 96. Don't know what he is writing. Every story is writing. From childhood is writing till and whatever the advantage, disadvantage in his life, everything is writing. So he got 96. Very good. Listen. One student. Underline this word. Outlier in the higher end, right skewed data. Outlier in the lower end, left skewed data. Preferred measure of central tendency for skewed data, it is median. Always remember median. If I am asking this question, listen to the words properly. If I am asking this question, what is the formula for coefficient of variation? 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 Standard deviation by mean into 100. Yes, very good. If I am asking this question, listen. Standard deviation is 3, or for example, standard deviation is 2, mean is 4. What is coefficient of variation? Standard deviation is 2, mean is 4. What is coefficient of variation? What is coefficient of variation? 50% means your deviation is how much percent of mean? Your deviation is how much percent of mean? 50%. 50%. Yes, good. For example, I am telling, listen to the words properly. For example, I am telling the variables are measured in two different units. Like if I take one variable, height, one group you are measuring in centimeter, the other group you are measuring in inch. One group you are measuring in centimeter, the other group you are measuring in inch. Later you want to compare the amount of variation. Which group is showing more variation? What is the preferred measure for this purpose? Answer my question. Think and tell, everything is there in the formula. Height you are taking for girls. Height you are taking for girls. Height you are taking for girls. See the words properly. Height you are taking for girls in centimeter, for males in inch. Later you want to compare the amount of variation. What should be used? Coefficient of variation will be used. What is the reason? Think and tell. What is the reason? See the formula. Group 1, group 2. What is the reason? It is unitless dimension. Unit get cancelled off. Yes, good. Group 1 you calculate coefficient of variation. Group 2 you calculate coefficient of variation. Later the units get cancelled off. That is what I am telling. Yes, very good. This is very important question. This is the use of coefficient of variation. Repeatedly asked question. Yes, correct. Good. Now listen. Relationship between two quantitative variables. For example, I want to tell the relation between height and weight. What is that relationship called as? Correlation. What is that relationship called as? Correlation. So what is the definition of correlation? Relationship between two quantitative variables. Height and weight will show what type of correlation? Answer my next question. Height and weight will show what type of correlation? Positive or negative? Positive correlation, correct. Positive correlation. If I take one more word, income, if it is increasing, infant mortality rate will decrease. What is this type of correlation? What is this type of correlation? Income, if it is increasing, IMR will decrease. What is this type of correlation? Negative correlation. Good. Negative correlation. So what image we use to represent correlation? It is scatter diagram. The strength of correlation is given by correlation coefficient. Always remember this word, small letter R. Strength of correlation is given by correlation coefficient. Strength of correlation is given by correlation coefficient. Always keep in mind, correlation coefficient range from -1 to +1. The limit is always from -1 to +1. Correlation coefficient, the limit is from -1 to +1. Now tell, if they show this graph, what is correlation coefficient? If they show this graph, what is correlation coefficient? 0. There is no correlation. 0. Correlation coefficient, if it is 0, that means no correlation. Very good. 0. No correlation. Good. If it is -1, means perfect linear negative correlation. If it is +1, means perfect linear positive correlation. Now tell me, R is equal to +1 means what? Perfect linear positive correlation. Repeat my words. R is equal to plus 1 means perfect linear positive correlation. See the words properly. They will ask this question. Perfect linear positive correlation. So 0 to plus 1 is positive, 0 to minus 1 is negative. That is very simple. Yes. If they show this graph for you, what is correlation coefficient for this graph? Perfect landing is there. What is correlation coefficient for this graph? I am asking. What is correlation coefficient of this graph? -1. Good. -1. If I ask this equation for you, y is equal to a plus bx. Y is systolic blood pressure. X is salt intake. Y is systolic blood pressure. X is salt intake. Y is systolic blood pressure. X is salt intake. If I put the values, A is constant, B is regression coefficient. A is constant, B is regression coefficient. If I am putting the value like this, 2, 2. Now listen, if I increase my salt intake by 1 gram, how much will be the impact on systolic blood pressure? Answer my next question. If I increase my salt intake by 1 gram, see the equation properly. 2 plus 2 into 1, 2 plus 2, 4. How much will be the impact on systolic blood pressure? How much it will change? By how much it will change? By 4 millimeter of mercury. Yes, good. This is the use of regression. What is the use of regression coefficient or regression? If they ask, it is to predict the amount of change in dependent variable y with respect to independent variable x. This is the word repeatedly asked in the question. To predict the variation in dependent variable with respect to independent variable. What will change? So, what is used for this purpose? Correlation or regression? Answer my next question. To predict the amount of change in y with respect to x, what is used? Correlation or regression? Regression. Sampling. Different types. I am summarizing here directly. Just one image I am using. If I pick lottery method, anyone can come in the study. If I pick lottery, out of 110 students are selected randomly. What is this sampling called as? Answer my next question. Out of 100 students, 10 students are selected randomly. 10 students are selected randomly. Lottery method. If they frame words like this, every second or every third unit is selected, like this word will come. Every fifth unit, every 10th unit, if the words come like this, for example, I am telling, every third unit is selected. What is this sampling called as? Starting from random number, then every third unit is selected. What is this sampling called as? Systematic random sampling. Remember this word. Systematic random sampling. This word will come. Just I am summarizing it. One short session. Every third unit is selected like this. It is systematic random sampling. You do one thing. Divide them into two groups. Divide them into two groups. Then according to their size, you select randomly. What is this sampling called as? See there, dividing them into two different subgroups. Stratification is done. Stratification is done. Then according to their size, you are separately selecting boys, girls. Boys, girls. Subgroups you are doing. Then separately you are picking out of this how much, out of this group how much. Stratified random sampling. stratification is very important. They'll ask this question either based on age, sex, religion. You can divide them into two groups. Then according to their size you are selecting. That is stratified random sampling. Rather than selecting individuals, clusters are randomly selected. Group of individuals. What is this sampling called as? Answer my next question. Clusters are randomly selected. What is this called as? Instead of individuals, clusters are randomly selected. Group of individuals means cluster. What is this sampling called as? Cluster random sampling. Good. Cluster random sampling. You have to revise your class notes along with this. You have to revise your class notes along with this session. Always keep in mind. Then only it is highly effective. If you are having one base notes, then you are keeping one shot notes as the revision. It is so crisp that it is highly effective. Always keep in mind. Now tell me, to compare mean, we are using parametric test. Tell me the mnemonic for a parametric test. Tell me three words. SPA. S-P-A. SPA. S-P-A. Student t-test, pair t-test, ANOVA test. Student t-test, pair t-test, ANOVA test. If you are comparing mean values between two groups, what test is used? For example, group 1, group 2. You are giving treatment and placebo. Then later you are comparing the difference in mean hemoglobin levels between two groups. What test is used? Group 1, group 2. Between two groups you are doing. Mean hemoglobin levels you are comparing between two groups. What test is used? Student t-test. What is one more name for student t-test? What is one more name for student t-test? Unpaired t-test. Always remember this word. Yes, good. Unpaired t-test. But if you take only one group, weight is 60 kg, one group. After intervention, mean weight of the group decreased to 40 kg. One group, if you are comparing mean weight before after, what test is used? Answer my next question. If you are taking one group, before after you are doing, before it was 60 kg, mean weight decreased to 40 kg after intervention. What test is used? Paired t-test. Paired means same group, before after. Paired means same group, before after. If I do study in three groups now, answer my next question. If I do study in three groups, treatment A, treatment B and treatment C, three groups you are using, A, B, C. Later you are checking the mean hemoglobin levels between three groups, whether the difference is statistically significant or not. What test is used? ANOVA test. Very good. ANOVA test, because you are using more than two groups. Treatment A, treatment B and treatment C. So one group pair t-test, two groups student t-test, more than two groups, it is ANOVA test. Very good. So you can remember like this: one group, two group, more than two groups. One group, two group, more than two groups. So tell me the mnemonic for mean parametric test. Tell me the mnemonic again. For mean parametric test, tell me the mnemonic. SPA. Student t-test, paired t-test and ANOVA test. If I want to compare the proportions between two or more than two groups, for example, I am comparing success rates. Group 1 80% success, group 2 20% success, very less. If I want to compare the success rates in proportions, two or more than two groups, what test is used? Next question. To compare the proportions, group 1, group 2. Group 1, group 2. chi-square test. Either two groups if you take or more than two groups if you take. If you compare proportions, it is chi-square test. Chi-square test. Or you take one group. The prevalence of obesity is 80%. After intervention, it reduced to 40%. In the same group, you are comparing proportions. What test is used? Answer my next question. In the same group, if you are comparing proportions, see the words properly. If you are comparing proportions, what test is used? McNamara test. See the name proper. McNamara test. So tell me two tests used for proportions. Say the mnemonic. Chief Minister. C for chi-square test. M for McNamara test. Chief Minister. SPA for Chief Minister. Remember like this. Chief Minister for proportions. Depending on the number of group. You have to apply the flowchart in the exam. Direct questions will come. If I want to study association, odds ratio, risk ratio will indicate strength of association. That is different. Which test will tell whether the association is statistically significant or not? See the words properly. Odds ratio, risk ratio will indicate strength of association. But my question is like this. Which test will be used to indicate significance of association? Chi-square test. Always they'll ask this question. They'll give a 2x2 table for you. Then they'll ask what test is used to check the significance of association. Now again tell me true or false. Chi-square test can indicate strength of association. True or false? See the words properly. Chi-square test can indicate strength of association. Tell me true or false. Chi-square test can indicate strength of association. Again you are falling into the trap I am telling. True or false? False statement. Yes, very good. What will indicate strength? Ratios. But what will indicate significance? Chi-square test. Chi-square test. See, this is where you will be making small mistakes. Like this, if you make 10 mistakes, that is enough. Yes, very good. Small words, difference is there. Got my point? Good. Again, I am asking the same question. Chi-square test will indicate strength of association. True or false? Chi-square test will indicate the strength of association. True or false? Chi-square test will indicate strength of association. True or false? False statement. Very good. Regarding tests of association, for mean they will ask, for proportions they will ask. And sometimes they will ask significance of association also. Good. See this. Type 1 error means false positive error. For example, I am telling A is equal to B. But in your study you are telling A is better than B. Null hypothesis was true. Null hypothesis was true. Null hypothesis was true but rejected. What is this error committed called as? Tell me. A is equal to B, but you are telling A is better than B. Null hypothesis was true. There was no difference. There was no difference, but you are telling there is a difference. In your study, if you are committing, what is this type of error called as? False positive error committed in the study. False positive error committed in the study. Usually it is very difficult to eliminate this error because it is statistical error which can happen. Chance error we say. That is why we keep the upper limit. For most of the studies, what is the upper limit of type 1 error kept in the study? Answer my question. For most of the study, what is the upper limit we keep? Answer my question. I think you know this. Alpha, that is the upper limit what we keep. 5% is the most commonly used limit, na? Upper limit, what we keep is 5%. Good. Very good. Yes. Very, very good. Yes. If 5% is the upper limit, based on that you are committing the study, you are doing the study, but how much error you exactly committed in the study, which value will tell it? Tell me. After doing analysis, after doing tests, one value you get, that is p value. P value will indicate how much exactly you committed, how much is the error exactly committed in the study, that is given by p value. That is given by p value. Now tell me, error should be less or more? Error should be less or more? Always use some common sense. Error in the study should be less or more? Error what you commit should always be less in the study. Error should always be less in the study. If error is less than 5%, study is accepted. Null hypothesis can be easily rejected. Tell me yes or no. If the error is less than 5%, study findings will be very good. You can accept the study findings and you can reject the null hypothesis. Tell me true or false. That means p value should be less than alpha. P value should be less than alpha to accept the study findings, to tell it as statistically significant. P value should be less than alpha to tell the results are statistically significant. Study is accepted. Tell me true or false. P value should be less than alpha to accept the study findings, to tell the results are statistically significant. Yes, always p value should be less. Lesser the p value, better the study findings. Lesser the p value, more smileys. Always keep in mind. P jitna kam aayega utna badhiya. The whole night they will be doing party. Pharmaceutical companies, na? Their party, the level of party, what they do depends on p value only. Less p value, more party. P value come, more party. Party, party. P value come, party, party. Come to the other side. False negative error. False negative error means actually A is better than B, but you are not identifying the difference. You are telling A is equal to B. A is better than B, but you are telling A is equal to B. Not able to identify a significant difference. Other countries' vaccine was beneficial, but in your study you are not finding the benefits of that vaccine. What error you are committing? Answer my next question. African countries, when you are doing the trial, the conditions and the trial was done and the vaccine was proven to be beneficial. But in your study, you are not finding that benefit. What error you committed? What error you committed? Type 2 error. Yes, very good. Type 2 error is also called as beta. This will happen because of less sample size, less number of patients in the study. Beta error is due to less sample size. Always keep in mind. How to reduce beta error? Answer my next question. Tell me in common words. Tell me in common words. Good. How to reduce beta error? How to reduce beta error? How to reduce beta error? Increase the sample size. That is called as power of a study. Power means ability to identify the difference. Power is ability to identify that difference. Very good. That means power is directly proportional to sample size. True or false? Next question. Power is directly proportional to sample size. True or false? See my next question. Power is directly proportional to sample size. True or false? Good. Very, very good. Power is directly proportional to sample size. We ask all these questions for you. Tuberculosis elimination program. Now we are doing CBNAT in all the patients. Either we do CBNAT or TrueNAT. That is called as universal drug susceptibility testing. Means all the patients should have baseline CBNAT result before starting treatment. Tell me true or false. All the patients should have baseline CBNAT result before starting the treatment. Tell me true or false. True, because we need to rule out resistance. If the patient is not having any resistance, drug sensitive tuberculosis, 6 months of treatment, 2 months of intensive phase, 4 months of continuation phase. 2 months of intensive phase, 4 months of continuation phase. 6 months daily regimen. 6 months daily regimen. See the words properly. Ethambutol is not used in continuation phase. True or false? Ethambutol is not used in continuation phase. True or false? Ethambutol is not used in continuation phase. True or false? False statement. It is used. Fixed dose combination is used. Always keep in mind. Fixed dose combination. So one tablet will have all the drugs together. That means number of tablets per day is decided based on which criteria? Answer my next question. Number of tablets per day is decided based on body weight of the patient. Number of tablets per day is based on body weight of the patient. So any patient of TB, HIV will be rolled out, and any patient of HIV, TB will be rolled out. This is called as cross referral. Keep in mind, this word is called as cross referral. What is the reason why we have to rule out TB? Because this is the most common opportunistic infection. So any case of HIV, usually HIV will indirectly present as tuberculosis only. Most common opportunistic infection in HIV is TB. At the same time, most common cause of death in HIV is also TB. What is the answer? Repeat. What is the most common cause of death in HIV? Again, the answer is tuberculosis. That is why TB has to be ruled out. What is the test we do for ruling out tuberculosis? What is the answer? CBNAT. All HIV patients, in order to rule out TB in HIV patients, we have to do CBNAT. If both are diagnosed together, start ATT, then add ART. Keep a gap of 2 weeks. Keep a gap of 2 weeks. ATT followed by ART. If at all there is TB, meningitis and HIV, what should be the gap? 4 weeks. If there is TB, meningitis and HIV, the gap is 4 weeks. Start ATT and ART together. True or false? Answer my next question. Start ATT and ART together. True or false? False. Normally we keep a gap of 2 weeks. If both are diagnosed together, I am asking. In case of TB, meningitis and HIV, if they are diagnosed together, keep a gap of 4 weeks. This is regarding HIV tuberculosis. TB, we do active case finding also, going to houses usually in slums and tribal areas. Always keep this word, tribal areas. What disease has to be screened for? Going to that locality, active case finding. What is the website for TB notification? Tell me. What is the website for TB notification where you fill monthly reports? What is that website called as? Online will be going, na? Nikshay, good. Nikshay, Kshay Roga means TB. Nikshay is TB website. The notification of Nikshay, the frequency is every week, weekly once, true or false? The frequency is weekly once, true or false? Answer my question. True or false? False statement. It is monthly reports what you are filling. After notification, the doctors will be given 5,000 rupees. False statement. That much we cannot give. 1,000 rupees. 500 plus 500. This is for the notification what doctors will get. 500 on notification. Later 500 they will give for outcome declaration. How much you will get when you notify a case of TB? Tell me. Through Nikshay website, how much you will get for notifying a case of TB? Total 1000 rupees per patient. First they will give 500 rupees. Later they will give 500 rupees. Don't ask together. नहीं मुझे अभी दे दो 1000 rupees अभी दे दो. No. 500 plus 500. After completing the treatment, outcome declaration 500 rupees. 269 270 IPC section, very important. These two IPC sections will deal with spread of communicable disease. So TB notification is mandatory. Tell me true or false. TB notification is mandatory and it is under IPC section. True or false? True statement. Yes, good. True statement. How much the patient will get? 500 per month during treatment. This is Nikshay Poshan Yojana. 500 per month during treatment, not lifelong. It is not salary, it is during treatment. 6 months of treatment, 500 every month. Right now we are giving, on calculation is 500 per month only. 1500 we are giving 3 months once. But remember like this is Nikshay Poshan Yojana. The doctor will get 1000, the patient will get 500 per month. 500 per month. Yes, nutritional expenses. 99 dots. You know this. Hidden numbers are there. We are giving missed call. The patient will give missed call to that hidden number. Nobody will receive the phone. Nobody will receive the phone this side. Remember this. It's not like hello, haan, lelo and all. Nobody will tell that. It is just missed call. Missed call initiative. The software will identify the call. Yes, this will tell whether the patient is taking treatment or not, adherence to treatment. If the patient is not giving missed call for 2 days, SMS based notification will go to the patient. Dots provider, they will go and counsel the patient. Why you are not giving missed call? Patient will tell his own story. I was watching match in Jio Cinema and all. I cannot give missed call. I forgot. Sorry and all. No, you have to give. You have to give missed call. There is retrieval system also. SMS based notification also is there. One student was asking, sir, can we keep CCTV cameras in the future? Yes, that can happen in the future, not now. In front of CCTV, the patient is going and telling, hi, big boss. Then the camera will nod, hi, big boss, and all that concept will take some time. We don't have money. The patient is having phone. We are keeping hidden numbers. Patient will just give missed call just to check whether the patient is taking treatment or not. What is this initiative called as? Answer my next question. What is this initiative called as? 99 dots. 99 dots. Yes, good. Patient block the number means breakup. What if patient blocks the number? Number block हो गया मतलब breakup है. Remember this. Continue the next thing. Don't ask such doubts to me. 99 dots. So don't make mistake. What is 99 dots? What is Nikshay Poshan Abhiyan? What is mandatory notification? What is Nikshay? Don't make mistake. Nikshay is different. Nischay is different. What is Nischay? Nischay is different. Nischit. Nischay is different. Nischit. Pregnancy testing kits. That is Nischay, Nischit. Pregnancy testing kits. Okay, good. Yes. Very good. Yes. See this word. Janani Suraksha Yojana. Pregnant will come to the hospital and deliver. For that she will be given some incentives. Low performing states, high performing states. Total 10 low performing states are there. Very easy to remember. UP Uttarakhand was together, now it is separate. MP Chhattisgarh was together, now it is separate. Bihar Jharkhand was together, now it is separate. Along with that 4 states, you can remember the mnemonic. Roja. R for Rajasthan, O for Odisha, J for Jammu Kashmir, A for Assam, total 10 low performing states. Why I am telling this? Because low performing state, all the pregnants will get incentives. Low performing state, all the pregnants will get incentives. High performing state, we ask the certificates below poverty line or SC/ST certificates will be taken. Listen to the words properly. Low performing state, all the pregnants will be given incentives, and always keep this update. It is irrespective of age and parity. Cash is given up to 2 live births only, true or false? Cash incentives will be given up to 2 live births only, true or false? True or false? Up to 2 live births. Listen to my words properly. Up to 2 live births, true or false? False statement. Number of live births, it is not a criteria now. Age is also not a criteria. How much will be given for hospital deliveries? How much will be given for home deliveries? Remember, mother will get, Asha will also get. How much Asha worker will get in rural areas? Answer my next question. How much Asha worker will get in rural areas? How much Asha will get in urban areas? We promote rural area. Delivery rate should be more in rural areas. How much Asha worker will get in rural areas? 600 rupees. Yes. How much mother will get in Madhya Pradesh? Tell me, rural area. How much mother will get in Madhya Pradesh? Rural area. How much mother will get in Madhya Pradesh rural area? 1400 rupees. Yes, good. Don't ask doubt what if Asha becomes pregnant. That was the doubt which has been asked long back, but still some students are asking the same thing again and again. Asha, if she becomes pregnant, she will become mother. No need to write all this in the notes. Asha, then mother, then pregnant. Read whatever is there. Asha is Asha. Then it is 600 in rural area, 400 in urban area. Examiner is not going to that level. Don't outsmart yourself or don't think that examiner is going to that level. Not possible. They won't think like this. Remember this. That frequency should match. That thinking level should match. Then only you will get the correct answer. 500 rupees for BPL pregnancy if it is home delivery. Home delivery. How much Asha will get in home delivery? Tell me. How much Asha workers will get in home delivery? How much Asha worker will get in home delivery? Nothing. Zero. Kali Hath. Asha workers should promote hospital deliveries. If you are giving money for home deliveries also, then they won't be knowing where was the delivery, what has happened there. Simply phone pay, if she is opening, 200 rupees is coming to their account. No, that should not be the thing. We should give money for hospital deliveries only. Mother, why we are giving? Because in the next one, once we are going to the house, we'll counsel her properly. Now you are getting 500 rupees. Next come to hospital, you will get more. That is the way we are counseling the mother. And we also tell the Asha, you have to promote hospital deliveries more. That is what we are telling. So got my point? Home delivery, any state, any area, how much mother will get? 500 rupees. Cash incentives are not given for home delivery. No. Now this is the newer update. Cash incentives are also given for home delivery. JSY will give money. What is that scheme which give free services? What is that scheme which give free services? We say the mnemonic DTC, Delhi Transport Corporation. What is a scheme that gives free services? Janani Shishu Suraksha Karyakram. Janani Shishu Suraksha Karyakram means infant. जननी के साथ शिशु को भी मिलेगा कुछ ना कुछ. There is nothing for pati, pitru, father and all. Remember this word. It is always जननी सुरक्षा और जननी के साथ शिशु को भी कुछ सुरक्षा मिलेगा. Remember the words properly. जननी शिशु सुरक्षा कार्यक्रम. The mnemonic is DTC, Delhi Transport Corporation. Diet, drugs and diagnostics. Diet, drugs and diagnostics. Transport facility, home to hospital, again back to the home. Drop back facilities also available. No sightseeing, no shopping in between. It is home to hospital, hospital to home, and in between hospitals also there is free transport. Keep this in mind. In between the hospitals, if I want to refer a sick infant, free services are given. Free services are given. This is very, very important. What is this scheme called as? Tell the mnemonic. DTC. Delhi Transport Corporation. DTC. Every month, like 9th of every month, there is an antenatal clinic. What is that clinic called as? 9th of every month, there is an antenatal clinic. What is that clinic called as? Pradhan Mantri Surakshit Matritva Abhiyan PMSMA clinics, where we identify danger signs. When the pregnant is coming to this clinic, during our visit, we do investigations also. 4 stickers are there that will indicate the condition of the pregnant. Very, very important scheme. Green, red, traffic signal. Remember this. What sticker is used for pregnancy induced hypertension? Next question. What sticker is used for pregnancy induced hypertension? B, blue. Remember like this. B for blue. B for blood pressure. What is used for gestational diabetes, hypothyroidism, PIDs? Tell me, what sticker is used for gestational diabetes, hypothyroidism or PIDs? Yellow sticker. Any other risk factor other than this will go in what sticker? Any other risk factor other than this will go in what sticker? Red color sticker. Very good. Red color sticker. Red color sticker. Yes, very good. Don't make mistake between these 2 schemes. What is used to promote labor room quality? L for labor room, L for Lakshya. That is to promote labor room quality. But training doctors and nurses for delivery practices. What is that scheme called as? How to manage complications, how to conduct deliveries. How to conduct deliveries. Yes, training doctors and nurses for delivery practices. See the words properly. Dakshata, yes. L for Lakshya, L for labor room. D for Dakshata, D for delivery practices. This is one more scheme, very important. See the full form. Surakshit Matritva Ashvasan. Ashvasan means guarantee. Whatever the services supposed to be given for pregnant and infant has to be given. Guarantee means first thing what we do is every hospital will display a chart. Notice board, service guarantee charter, like the menu in the hospital. It is already displayed there. These are the services I should get. Second thing, if the service is not given, you can raise the complaint. There is grievance redressal mechanism also. By doing these 2 things, we follow zero tolerance policy. It means Ashvasan, guarantee, the service has to be given. How to make sure the service will reach the beneficiary, that is important. How to make sure the service will reach the beneficiary, that is very, very important. By giving one, service guarantee charter in the hospital, and second, grievance redressal mechanisms. So zero tolerance policy is followed under which scheme? So that service has to reach the beneficiary. What is your answer? Zero tolerance policy is followed in which scheme so that the service has to reach the beneficiary? Suman scheme. Yes, good. Coming to child mortality, the previous slide was maternal related, mother related schemes. Come to child related scheme. Asha worker is giving home visits after delivery to reduce neonatal mortality rate. What is that scheme called as? What is that scheme called as? Home based newborn care. Remember this word, home based newborn care. S, B and C, home based newborn care. Total how many visits? Tell me in descending order. Total how many visits? 7, 6, 5. 7 for home delivery, 6 for vaginal delivery, 5 for cesarean section. One visit will be less. 7, 6, 5. Yes. How much incentive the Asha worker is getting? 250 rupees per child, not per visit. Per visit we cannot give this much. Per visit if you are giving this much, consultant level, no. 250 rupees per child I am asking. Twins, how much Asha will get if it is twins? 500 rupees. 500 rupees, yes. No need to write like this. Asha worker incentives is directly proportional to number of children and all. No need to interpret like that. They won't ask that question. So just remember 250 rupees per child. 250 rupees per child. This is separate scheme. Don't make mistake. Home based care of young child. Here also home visits by Asha worker where she will be counseling for nutritional purpose. The main purpose of this is nutrition. How much Asha will get for completing all the 5 visits? How much Asha worker will get for completing all the 5 visits? This scheme is totally different. Don't make mistake in the exam. I have seen students making mistake. HBNC is different from HBYC. Okay. Home based newborn care. Home based newborn care is different from home based care of young child. What my point? Home based newborn care is different from home based care of young child. Hospital level, facility based newborn care. Special newborn care units. See the words properly. Special newborn care units is at district hospitals. Newborn stabilization unit is at community health center. Newborn care corner is at labor rooms. So repeat my words. Special newborn care units is at district hospital. Newborn stabilization unit is at community health center. Newborn care corners it at labor rooms. Now if I am asking, if you are going to a labor room visit, what you should see there in facility based newborn care? Tell me the words. If you are going to a labor room for visit, what you should see there as per facility based newborn care? According to this scheme, you have to see newborn care corner. Newborn care corner. Yes. NCC. What is the target of Indian Newborn Action Plan? Single digit neonatal mortality rate. Single digit stillbirth rate has to be achieved by which year? According to Indian Newborn Action Plan. Answer my next question. Single digit neonatal mortality rate and stillbirth rate has to be achieved by which year? By 2030. By 2030. What is that scheme where you do screening and take early intervention? What is that scheme called as? What is that scheme called as where you do screening so that you take early intervention later? Screening we do, taking early intervention later. Rashtriya Bal Swasthya Karyakram. Defects, deficiency, disease, developmental delays. Defects, deficiency, disease, developmental delays. Deficiencies what we screen for? Vitamin A, anemia, vitamin D, goiter, severe acute malnutrition. Now tell me, zinc deficiency is screened, true or false? Vitamin A, anemia, vitamin D, goiter, severe acute malnutrition. Zinc deficiency is screened. Tell me true or false? False statement. We are not screening for zinc deficiencies. Screening is done in the age group 0 to 18 years. Keep this in mind. So screening is done also in schools, Anganwadi centers, community, also house to house. So screening is done in schools, Anganwadi centers, community. So this is the basics what they ask in Rashtriya Bal Swasthya Karyakram mainly. I'm just making it more concise. Summary part I'm telling. Malaria drug policy, you should remember treatment and chemoprophylaxis. treatment and chemoprophylaxis. Very, very easy topic. Don't make mistakes in treatment and chemoprophylaxis, that too in malaria part. Falciparum, we are using ACT for 3 days. Primaquine, 1 dose. What is the role of primaquine 1 dose in falciparum? Answer my next question. What is the role of primaquine 1 dose in falciparum? Very good. Gametocidal recrudescence. Very good. Correct. Gametocidal. Yes, correct. ACT for Northeast states, ACT for other states. Northeast we use artemether lumefantrine. Other states we use artesunate SP combination. What is the ACT used in Northeast states if they ask? Artemether lumefantrine. Always remember this word. Artemether lumefantrine. Vivax we use chloroquine for 3 days. Primaquine for 14 days. What is the role of primaquine 14 days in Vivax? Answer my next question. What is the role of primaquine 14 days in Vivax? To reduce relapse. Radical cure, hypnozoids. Very good. Liver. Yes, correct. Mixed infection means you have to make a mocktail out of this. Falciparum plus Vivax. You have to make a mocktail or cocktail out of this. ACT for 3 days. Primaquine for 14 days. ACT for 3 days. Primaquine for 14 days. Oval managed as Vivax. Malaria is managed as Falciparum. How to manage Plasmodium malariae in Northeast states? Next question. How to manage Plasmodium malariae in Northeast states? Tell me. How to manage Plasmodium malariae in Northeast states? Northeast. Artemether lumefantrine. Primaquine 1 dose. Artemether lumefantrine. Primaquine 1 dose. Very good. Pregnancy, falciparum you should know. What is contraindicated in first trimester? Answer my next question. What is contraindicated in first trimester? What is contraindicated in first trimester? ACT. That is why we are using quinine. What is used in first trimester? Quinine. What is used in first trimester? Quinine. Remaining all the trimesters we can use ACT. Chloroquine can be used for Vivax management, and very important, the drug which is contraindicated in pregnancy. Primaquine is contraindicated. Tell me true or false. Primaquine is contraindicated. Tell me true or false. Primaquine is contraindicated. Tell me true or false. True statement. What is the chemoprophylactic drug if the stay is within 6 weeks? What we use? Doxycycline. More than 6 weeks, mefloquine. If both are contraindicated, you can use chloroquine. If mefloquine is contraindicated, if the stay is for more than 6 weeks, what drug is used for chemoprophylaxis? Answer my question. See the mnemonic. Delhi Medical Council, doxymeflochloroquine. If the drug is like mefloquine, long-term stay, contraindication. Delhi Medical College, okay, Delhi Medical Council, good. Chloroquine can be used. Short-term stay, doxy. Long-term stay, meflo. If mefloquine is contraindicated, I am asking. Like any cardiac conditions, convulsions, the stay is for long term but having history of convulsions and all, if they give such question, answer is chloroquine. Tell me 3 drugs for chemoprophylaxis. After treatment we are discussing chemoprophylaxis. Tell me 3 drugs for chemoprophylaxis. DMC. Delhi Medical Council. Very good. Kala-Azar diagnosis. If the patient is Kala-Azar suspect, we are doing one test, one drop of blood. We are testing 2 lines we get. What is the test we do called as? Rapid diagnostic kit. What is the test called as? Tell me. RK39. RK39, if it is positive, start treatment. No need for any confirmation. No need to go for biopsy. No need to go for bone marrow aspiration, nothing. Just start treatment. The drug of choice for Kala-Azar is LAM, liposomal amphotericin B. What is the drug of choice? Liposomal amphotericin B. Now, single dose infusion. That is what WHO is telling, what we follow in our country also. Miltefosine is not the drug of choice. Miltefosine is oral drug, which is used and given under observation. What is the oral drug for Kala-Azar which is given under observation? What is your answer? Very good. What is the oral drug for Kala-Azar which is given under observation? That means directly observed treatment I am asking. Miltefosine. Miltefosine. Miltefosine is not the drug of choice for Kala-Azar. Miltefosine is the drug of choice for post-Kala-Azar dermal leishmaniasis. What is the drug of choice for PKDL? Next question. What is the drug of choice for post-Kala-Azar dermal leishmaniasis? Miltefosine is the answer. They'll give a history of Kala-Azar long back. Now the patient is having some nodular lesions on the back, extensor aspects. Leprosy was ruled out. Like that they'll mention post-Kala-Azar dermal leishmaniasis. Miltefosine. Kala-Azar fortnight we celebrate every 3 months once. Quarterly search. Searching for 2 weeks done only in endemic areas. This is active case finding. Kala-Azar fortnight means every 3 months once they will go and stay there. They will be doing searching of cases. Active case finding. This procedure is called as Kala-Azar fortnight. What is the vector of Kala-Azar? Tell me. What is the insect? What is the vector for Kala-Azar? Sandfly. Phlebotomus. Now we are using synthetic pyrethroids. Now we are using synthetic pyrethroids. Before it was DDT. Now we are using synthetic pyrethroids for indoor residual spray. Usually we do it in cattle sheds. Within the cattle sheds up to a height of 6 feet. Indoor residual spray is done up to a height of how much feet for sandfly control? Answer my question. Everything is yes in this. Sandfly 6 feet. Synthetic pyrethroids, cattle sheds, Kala-Azar control. Kala-Azar control. Good. HIV. So remember this. ERT, that is test and treat policy. All HIV patients will be started on treatment irrespective of clinical staging, irrespective of CD4 count. No need to do baseline CD4 counts or baseline CD or clinical staging is not necessary. What is the combination used for HIV treatment? Answer my next question. What is the combination used for HIV treatment? You can see there, fixed dose combination. One tablet is having all the drugs together. Fixed dose combination. What is that combination called as? Yes, good. TLD combination. Even in pregnants also. We are using TLD now. We are using TLD. What newborn will get? Prophylactically I am asking. What newborn will get? If the mother is on ERT, we use nevirapine. Minimum duration 6 weeks. Maximum duration 18 months. Minimum duration 6 weeks. Maximum duration 18 months. If the mother is not on ERT, 2 drugs has to be used. High risk infant. What are the 2 drugs used if the mother is not on ERT? This is the question. What are the 2 drugs used if the mother is not on ERT? nevirapine plus zidovudine. Yes, that is high risk infant. Early infant diagnosis, we use total nucleic acid PCR now. This is one update what you should know. What is the investigation of choice for early infant diagnosis? Answer my question. What is the investigation of choice for early infant diagnosis? TNA PCR, total nucleic acid PCR. Before DNA, then came RNA. Now we are using TNA PCR, total nucleic acid PCR. Exclusive breastfeeding can be done in India. Yes. But always the ideal method is artificial feeding. What is the ideal method of feeding in HIV infant? Answer my question. Artificial feeding. Even during prophylaxis also they have to prefer artificial feeding. That is the ideal method. But in Indian conditions, exclusive breastfeeding can be done. These two words they will mention separately. Ideal it is artificial feeding, exclusive breastfeeding can be done. After exposure, post-exposure prophylaxis, we can use TLD for 4 weeks. Everywhere it is TLD. The upper limit for starting post-exposure is within 72 hours. The upper limit for starting PEPs, that is post-exposure prophylaxis, is 72 hours. But according to WHO, see the words properly. What is the best combination? What is the best combination? See the words properly. If the mother, listen to the word properly. If you are exposed to this, if you are exposed to HIV body fluid, what is the best according to WHO? TET combination. TET combination. This was a question in the exam recently. TET is the best for post-exposure prophylaxis. E is emtricitabine. E is emtricitabine. Highlight this word. E for emtricitabine. ERT, PPTCT and post-exposure. Post-exposure prophylaxis. Polio surveillance. Any case of acute flaccid paralysis. See the words properly. Any case of acute flaccid paralysis, how many samples we have to collect? Everything is 2 in this. Everything is 2. Remember this. 2 samples today, tomorrow. Ideally within 2 weeks from the onset of paralysis. The maximum limit is 2 months. After that, no use of sample collection. The maximum limit is 2 months, 60 days. And once you collect this sample, the transport temperature is 2 to 8 degree. In the same carrier, it will go. Same carrier, it will go and reach the lab. It should reach lab within 72 hours. Reach lab within 72 hours. Remember this word. What is this chain called as, which is going in the ulta direction? Vaccine will come from higher to lower, but stool samples are going from lower to higher. This is the direction. What is this chain called as? Reverse cold chain. This chain what is used for transport? This chain what is used for transport is called as reverse cold chain. Good. 60th day you are going and checking for residual paralysis also. Wasting in the muscle you will be checking. That is on 60th day. All the cases of AFP should be confirmed as polio or not within how many days? Repeat my next word. All the cases of acute flaccid paralysis should be confirmed as polio or not. What is the upper limit given? See my words properly. Upper limit from the onset of paralysis. Good. Upper limit. "90 days, 90 days. Good. Whether surveillance is properly done or not, that is what we are checking. Identify cases of AFP. In a given year, we have to identify at least how many cases to show our efficiency. Answer my next question. In a given year, if you are having 1 lakh population under surveillance, 1 lakh population under surveillance, yes, at least we have to identify 2 cases. Anything, AFP can be anything. Guillain-Barré syndrome, transverse myelitis, traumatic neuritis. Anyhow, polio is eliminated, but polio is not eradicated. Polio is not eradicated. So all these things has to be done now also until the disease is eradicated. So to show operational efficiency, what indicator is used? Non-polio AFP rate. Remember this word. Adequate sample collection should be done within how many weeks? What is the definition of adequate sample? 8 gram per sample collected within 2 weeks. Remember the words properly. 8 gram per sample collected within 2 weeks. Collected within 2 weeks. Adequate sample collection should be done from 100% of the cases. True or false? Answer my question. Adequate sample collection should be done from 100% of the cases. True or false? Adequate sample collection should be done from 100% of the cases. True or false? False statement. Adequate sample collection should be done from 80% of the cases. Keep this in mind. 80% of the cases, because the definition is like this. Within 2 weeks. That criteria is also taken as adequate sample. Adequate sample collection should be done from 80%, not 100% of the cases. This is one important thing what they are asking. This is regarding polio surveillance indicators. Leprosy treatment is using red packs, what you are seeing there, for all the patients. Paucibacillary leprosy, how many months? 6 months. Multibacillary leprosy, 12 months. So treatment is same, only the duration is different. Only the duration is different. The patient on day 1 will get what drugs? Tell me 3 drugs. R, C, D. Type it in the chat box. Patient on day 1 will get what drugs? R, C, D. Rifampicin, clofazimine and dapsone. Dose will be asked. Rifampicin, clofazimine and dapsone. Day 1. For the remaining days, the patient will get C and D. Clofazimine dose is less, 50 mg, dapsone tablet. Like this, 1 pack is sufficient for 1 month. 1 pack is sufficient for 1 month, I am asking. How many packs we need for paucibacillary leprosy? How many packs we need for multibacillary leprosy? Tell me. How many packs we need for pauci? How many packs we need for multi? 6 and 12. 6 packs for pauci, 12 packs for multi. Good. This is regarding treatment. All the contacts in the family, close contacts, will take chemoprophylaxis. What is the drug used for chemoprophylaxis? Answer my next question. What is the drug used for chemoprophylaxis? Single dose rifampicin for close contacts. We are using single dose rifampicin. Yes, good. Single dose rifampicin for close contacts. What is the campaign used to create awareness in leprosy? Sparsh campaign. Sparsh means touch. Touch sensation is less. The campaign what we keep is Sparsh to create awareness. The mascot used is Sapna. The mascot used is Sapna. Leprosy mascot for India under the program. Don't confuse. Meena is not for leprosy. Meena is for girl empowerment. You are making mistake. Meena is girl empowerment. You will be having a girl with that parrot behind. That was the concept initially by UNICEF. Girl empowerment. That concept was used and Sapna was made for leprosy. Meena is for girl empowerment. Sapna is for leprosy. Yes, good. Listen to the word. Yes. What is the mascot used under Sparsh campaign? Remember this. Sapna. This is regarding leprosy. Slight things they'll be discussing in dermatology also, I think. Now, one short session, even in derma also, they'll be covering the clinical manifestations of leprosy a bit. Syndromic management, STI kits. What clinics will take care of STI management? What is the name of the kits? What is the name of the clinics I am asking? Suraksha clinics. Suraksha clinics. Grey, green. Remember the kits. Grey, green. Yes. White, blue, red for ulcers. White, blue, red for ulcers. Yellow and black. Yellow and black. Total 7 kits. Grey, green, white, blue, red, yellow and black. Now what is used for cervical discharge? Next question. What is used for cervical discharge? Kit 1. What is used for vaginal discharge? Kit 2. Non-herpetic ulcer? Kit 3. If the patient is allergic to penicillin, we can use kit 4. Red color kit important, herpetic ulcer. Herpetic ulcer. Lower abdominal pain, yellow color. Inguinal buboes, black color. Inguinal buboes, black color. Go green with blue rivers and yellow birds. There are so many mnemonics for this. I remember like this. Go green. You're going to any picnic. Go green. You'll be seeing all the greeneries around. Then with one blue river. You can see one blue river going in and around. And there are few yellow birds flying. Yellow birds are very rare. You will be seeing yellow colored birds. But if the birds are flying, just imagine there is one yellow, 2-3 yellow birds flying here and there. So, okay, good. So, okay, there are 7 kits for syndromic management. What kit is used for herpetic ulcer? I am asking the number now. What kit is used for herpetic ulcer? Kit 5. Kit 5. Rabies. One short session will be covering vaccine part. Very important. Post-exposure prophylaxis. There are 2 schedules. One is intradermal schedule and intramuscular schedule. See the names. Number of visits will be different. Here 4 visits, here 5 visits. How many visits in SN schedule? Answer my next question. How many visits in SN schedule? How many visits in SN schedule? See the words properly. How many visits in SN schedule? Total 5 visits. Intradermal, if it is given 2 site, intramuscular it is 1 site. Now it is not luteal area, it has been changed. I'll change this to deltoid. Intramuscular we give it in deltoid. See the number of days. 4 visits, 5 visits. Intradermal, both deltoids were given. Each deltoid. Good. Each deltoid. Pre-exposure prophylaxis. Someone is at risk of dog bite or animal exposure should take 3 visits. 3 visits. Either intramuscular or intradermal. 3 visits for the patient. 0, 7, 21 or 28. Now if they ask this question, forest officer, animal handlers, they have to take pre-exposure prophylaxis. Forest officers, animal handlers, they have to take pre-exposure prophylaxis. Re-exposure. If the dog is biting again and again, you should know the reason first, but still I am asking the question now. If the dog is biting again and again, if the bite was within 3 months, nothing to be done. If the bite is after 3 months, 2 visits without immunoglobulins. Keep this in mind. 2 visits without immunoglobulins. Immunoglobulins should not be used. the bite is second time after 3 months. After 3 months. So it's very, very easy to remember the number of visits. Just I will summarize this. Listen now. Very easy to remember. Continue. It's very, very easy to remember. Only thigh schedule 2 site, remaining all 1 site. Only thigh schedule 2 site, remaining all 1 site. And see the number of letters. Thigh 4 letters, 4 visits. SN 5 letters, 5 visits. Pre 3 letters, 3 visits. Re 2 letters, 2 visits. Got my point? Number of letters corresponding to number of visits. Thigh 4, SN 5. Both are for post exposure. Pre exposure 3 visits. Re exposure 2 visits. Re exposure 2 visits. Re exposure 2 visits. This is regarding rabies. Tell me in descending order 5, 4, 3, 2. I want everyone to type this. 5, 4, 3, 2. 5, 4, 3, 2. Emerging infections, very, very important. Crimean Congo hemorrhagic fever, the reservoir is cattle and camel. Those who work with cattle, camel, veterinary doctors or farmers will be affected. The vector is hard tick. When there is tick bite, you will suffer with viral hemorrhagic fever. Now answer my question. What is the vector of CCHF? Answer my question. What is the vector for CCHF? Crimean Congo hemorrhagic fever. Vector I am asking. Hard ticks. Hard ticks. Good. Nipah encephalitis. The reservoir is fruit bats. The reservoir is fruit bats. First, what will happen? Initially in Malaysia, what happened actually? The bat was dropping the fruit and the pigs starts consuming it. And when the pigs will consume, they will start barking. Barking pigs will transmit infection to man. That was the route in Malaysia initially when Nipah happened. Bat, pig, man. Then what happened in Bangladesh? Bat was dropping the urine in the date palm sap what they used to consume. They used to keep the date palms, collection containers will be there. Bats will go and drop their urine. When you consume that, you will be suffering now. Bat to man. These questions will be framed in the exam. Then there is man-to-man transmission in the family. Within the family, there is man-to-man transmission. What is the differential diagnosis of Nipah infection? Answer my next question. What is the differential diagnosis for Nipah? Japanese encephalitis we have to rule out. Japanese encephalitis we are supposed to rule out. But if the question comes like this, exposure to bats, internal bleeding and death, what is the answer? After exposure to bats, internal bleed, will start bleeding, hypotension, shock. If the question comes like this, then it is Ebola hemorrhagic fever. You have to rule out yellow fever. The differential diagnosis will be yellow fever. How Zika will suffer with viral hemorrhagic fever? The problem with Zika is infection in pregnancy can lead to microcephaly. Which of the following can lead to congenital manifestations? What is your answer? Out of the 4 options, which can involve placental macrophages, through that it can infect a pregnant, leading to microcephaly in newborns. If they mention this question, what is the answer? Zika hemorrhagic fever. Zika can lead to all these things. What is the vector of Zika? What is the vector for Zika? Aedes. Good. See this question. What is the difference between crude birth rate and general fertility rate? See the difference in the denominator. Live births by mid-year population is crude birth rate. Live births divided by women in the reproductive age. Live births divided by women in the reproductive age. That is general fertility rate. So the difference is in the denominator. What is the denominator of general fertility rate? Answer my next question. What is the denominator of general fertility rate? Women in the reproductive age. Women in the reproductive age. Good. Total fertility rate and gross reproductive rate. What is the difference? Total fertility rate means how many children one woman will have. But gross reproductive rate is how many girls a woman will have. This is the difference. Total means children. Gross means girls. So that means in total, if you are counting both boys and girls, in total you are counting both boys and girls. In gross reproductive rate you are counting only girls. That means it is half the total fertility rate. Approximately I am asking. Gross reproductive rate is half of total fertility rate. True or false? This was one question. Very good. Half of total fertility rate. Tell me true or false. True statement. If the question is like this, total fertility rate is 2.6. What is gross reproductive rate? Tell me. Total fertility rate is 2.6. What is gross reproductive rate? Total fertility rate is 2.6. What is gross reproductive rate? 1.3. You can make half of it. And this formula also you should know. Total fertility rate is given in the question. If total fertility rate is 3, calculate crude birth rate. This was one question. Tell me the answer. Very good. Example I am asking. Total fertility rate is 3. What is crude birth rate? 25. Very good. 25. Net reproductive rate means how many daughters a newborn will have in the future. We have to count both fertility and mortality pattern. That is why this is the best indicator of fertility. Remember this, which is including both fertility and mortality pattern together. What is your answer? Out of all these indicators, which indicator includes both fertility and mortality pattern together? What is your answer? Net reproductive rate, because N for net, remember N for newborn girl, number of daughters a newborn will have in the future. Newborn will have in the future. So very easy to remember. T for total, G for gross girls, N for newborn will have in the future. NRR 1 is very, very important. One girl is replaced by one more girl. NRR 1 is very, very important. That is, population is at replacement level. What indicator is used to tell how many are using contraceptives in the community? Answer my next question. What indicator is used to tell how many are using contraceptives? Prevalence of contraceptive practice. You can have proportion, you can make a pie chart. Prevalence of contraceptive practice. Yes. Prevalence of contraceptive practice, CPR, couple protection rate should be how much? This was one question. To achieve net reproductive rate of 1. To achieve NRR of 1, it should be 60% and above. It should be 60% and above. Good. MCH indicators. Perinatal mortality rate, there are two formulas actually. One is just perinatal mortality rate if they ask, but second thing is perinatal mortality rate for international comparison. So what is the period of viability for India, so that after that we can tell as stillbirth? Answer my question. What is the period of viability for India? So that after that we can tell it as stillbirth. 28 weeks. 28 weeks for India. 28 weeks. Perinatal mortality rate means on the either side of the birth. It includes early neonate also. That is 0 to 7 days. 0 to 7 days. Here the denominator will be both live birth plus stillbirth. Live birth plus stillbirth. This was one question. If they mention international comparison, what we include? What is that one more criteria we are including? Answer my next question. If the question comes on international comparison, because some countries the period of viabilities can be different. To nullify that factor, what we include? Weight. Only those babies weighing more than 1 kg. Only those babies weighing weight more than 1 kg is included. This is for international comparison. See the question properly in the exam. Neonate is 28 days. Post-neonate is after that. When you are adding neonate plus post-neonate, what you will get? Next question. When you are adding neonate plus post-neonate, what you will get? See the question properly. When you are adding neonatal mortality rate plus post-neonatal mortality rate, what you will get? Infant, very good. Less than 1, under 5 is less than 5. This formula is also very important. Child survival index. If my question is like this, if under 5 mortality rate is 50, calculate child survival index. Answer my question. Under 5 mortality rate is 50. Calculate child survival index. How much you are getting? Under 5 mortality rate is 50. Calculate child survival index. How much you are getting? 95. Good. 95. Maternal mortality ratio. What is the denominator? Next question. And what is the multiplier? Any deaths which happen within 42 days we count. But my question is, if it is maternal mortality ratio, what is the denominator? What is the multiplier? Denominator is live birth. Yes. Multiplier is always 1 lakh. Multiplier is always 1 lakh. For India, we multiply with 1 lakh. Maternal mortality ratio. Vitamin deficiencies. Vitamin deficiencies. So listen to the words properly. Beriberi vernicase. So dry beriberi, wet beriberi. How dry beriberi presents? Peripheral neuropathy. How wet beriberi presents? Congestive cardiac failure. Dry peripheral neuropathy, wet congestive cardiac failure. What are the 3 things what you will be seeing in vernicase encephalopathy? Confusion, ophthalmoplegia, ataxia. Repeat my words. Confusion, ophthalmoplegia, ataxia. Along with this, they will give the history of chronic alcoholic, complaining of confusion, that is global confusion, yes. Ophthalmoplegia and ataxia. Ataxia, good, because of cerebellar dysfunction. Wernicke's encephalopathy. B2, it is angular stomatitis. B2, it is angular stomatitis. Niacin deficiency can lead to pellagra. What is that necklace what you are seeing there? Excoriations on the photoexposed parts. Even in the extensor aspects, photosensitive rash. Photosensitive rash. What is this? Called as Castle's necklace. Due to consumption of 2 things, maize and jowar. Tryptophan is converted to niacin. Tryptophan is converted to niacin. Lack of tryptophan in maize can lead to pellagra. Jowar is rich in leucine. So excess of leucine will block the conversion from tryptophan to niacin. Remember this word. Jowar is rich in leucine. excess of leucine will block the conversion from tryptophan to niacin. From tryptophan to niacin. So consumption of maize and jowar can lead to pellagra. True or false? Consumption of maize and jowar can lead to pellagra. The reason is maize there is lack of tryptophan. So once there is no tryptophan, there is no niacin. Rich in leucine will block the conversion from tryptophan to niacin. From tryptophan to niacin. B5 pantothenic acid burning feet syndrome, B6 peripheral neuritis. All basic questions. Now tell me what anti-tubercular drug will lead to B6 deficiency? INH, isoniazid, when you are using can lead to B6 deficiency. That is why we have to give B6 supplements. Pyridoxine supplements when you are using isoniazid. Very good. Folic acid can lead to megaloblastic anemia. What deficiency is seen among vegetarians if they make this question? If your diet is mainly based on veg-based diet, vegetarian-based diet. So what deficiency will happen if they ask this question? It is B12 deficiency. Neuropathy usually. Sometimes can lead to pernicious anemias also. One is vitamin E, one more is vitamin K. Don't make mistake. Which vitamin deficiency can lead to hemorrhagic disease of newborn? Answer my next question. Which vitamin deficiency can lead to hemorrhagic disease of newborn? Hemorrhagic disease of newborn, vitamin K. That is why we give vitamin K1 injection at birth. Vitamin K1 can prevent hemorrhagic disease of newborn. True or false? Vitamin K1 can prevent hemorrhagic disease of newborn. True or false? Vitamin K1 injection at birth can prevent hemorrhagic disease of newborn. True or false? True statement. Good. Anemia Mukt Bharat supplementation you should know. Till 5 years, starting from 6 months, we are giving bi-weekly 1 ml syrup. What is the composition of 1 ml syrup? Tell me in numbers. What is the composition of 1 ml syrup? 20 100 20 100 20 mg elemental iron, 100 microgram folic acid. 5 to 9 years, weekly once, pink color tablet. 45 400 is the dose. Weekly once, pink color tablet. 45 400 is the dose. Adolescents, we use blue color tablets weekly once. Dose is 6500. Dose is 6500. What is that scheme in school children called as? WIFS. Weekly iron folic acid supplementation. Weekly iron folic acid supplementation. 6500. Pregnancy, we give red color tablet. The dose is same. Only the thing is color change. Dose is same. 6 months during pregnancy, 6 months later. So during lactation also we give daily one red color tablet. Reproductive women, weekly once red color tablet. Weekly once red color tablet. This is Anemia Mukt Bharat. Anemia Mukt Bharat. Now tell me, what is the color of the tablet for 7-year-old child? Answer my next question. What is the color of the tablet for 7-year-old child? Pink color tablet. Pink color tablet. What is the composition? 45 400. 45 400. Consumption of kesar dal with this toxin can lead to spasticity. What is that called as? Lathyrus sativus if you consume. There is one toxin that can lead to spasticity. Beta oxalyl aminoalanine. Beta oxalyl aminoalanine. Yes. BOA. Beta oxalyl aminoalanine. BOA. So that is neurolathyrism, spasticity, where they cannot move from place to place. No stick, one stick, then they need two stick. Later they need crawlers to move from place to place. This is how it presents. Spastic paralysis, lathyrism, neurolathyrism. What vitamin can be used for prophylaxis? Answer my next question. Vitamin C. Or else you can do this also. Food processing techniques are there. Steeping can be done, parboiling can be done. These two things can be done to reduce the effect of toxin. Steeping and parboiling can also prevent neurolathyrism. Adding argemone to mustard, what will happen? The toxin is sanguinarine, there is pedal edema, that is bilateral pitting edema. What you'll be seeing is bilateral pitting edema, cardiac failure and glaucomas. What is this called as? Epidemic dropsy. That is why we are asking food inspectors. They will go to shops and they will be doing this test. Nitric acid test, which is most commonly done for detecting argemone. Paper chromatography test is the most sensitive test. Which is the most sensitive test to detect argemone if they ask? Answer my next question. Which is the most sensitive test to detect argemone? Yes, correct. Most sensitive test. See my words properly. Paper chromatography test. Crotalaria seeds, if you consume, they are hepatotoxic alkaloids presenting as jaundice and ascites. That is why we need to separate them. Tribal areas, usually when they consume, they don't know what is this seed. If they consume like that, there will be jaundice and ascites. That is called as endemic ascites. De-weeding, we have to separate these seeds. De-weeding will help in preventing endemic ascites. Good. What is that fungus which grows? Storage fungus. What is that fungus which grows on groundnut, maize when you are keeping in the moisture, godown's warehouse if it is not proper? That black fungus which accumulates. Hepatotoxic aflatoxins, that is aspergillus. They can lead to hepatocellular carcinomas also. Keep this in mind. Aflatoxins are hepatotoxic. They can lead to hepatocellular carcinomas. The thing is, avoid moisture. This was the question. Warehouse, storage condition should be proper. If they frame such question, answer is related to aflatoxicosis. But if they ask field fungus, don't make mistake. Don't make mistake in this. If there is a field खेती पे वहाँ पे if there is black fungus which is accumulating on bajra, if you are consuming that toxin clavin, long standing consumption is always a problem. Pain, tingling sensation in the feet, burning sensation in the feet. What is that called as? Ergotism. That is why we ask, float those grains, float those seeds in 20% salt water. Highlight this word. This will separate the fungus. Salt flotation technique is used to prevent ergotism. True or false? Salt flotation technique is used to prevent ergotism. True or false? Salt flotation technique is used to prevent ergotism. True or false? True statement. Good. So around last 30 minutes left. I'll be covering the remaining slides. So this side is on entomology. Listen. What is a vector for Bancroftian filariasis? Whatever I am highlighting, that is important for me. What is a vector for Bancroftian filariasis? Culex. Yellow fever, it is easy. Aedes. Don't make mistake. Brugian filariasis, it is Mansonia. This is the mistake you will be making. Bancroftian filariasis, Culex. Brugian filarias is Mansonia, which breeds in the roots of aquatic plants. You'll be knowing that. Mansonia breeds in the roots of aquatic plants. Sandfly will cause Kala Azar, oriental sore. These two things are important. What is the vector for African sleeping sickness? Answer my next question. What is the vector for African sleeping sickness? Sese fly, which resembles housefly. It is very, very dangerous. Sese fly. Epidemic typhus is louse. Endemic typhus is rat flea. Don't make mistake in this. Epidemic typhus is by louse. Endemic typhus is by rat flea. Rat flea is also the vector. The rat flea is also the vector for plague. What is the scientific name for rat flea? Tell me the basics. What is the scientific name for rat flea? Xenopsilla. Good. Xenopsilla chiopes. Redwood bug, Chagas disease, onchocerciasis, black fly, river blindness. KFD within India it is heart tick. KFD within India it is heart tick. Outside India can be due to soft ticks. Q fever, the agent is Coxiella burnetii. When it is transmitting between cattle to cattle, it is through soft tick. See the words properly. Cattle to cattle, it is through soft tick. Scrub typhus, trombiculid mite. What is the larva of trombiculid mite called as? Answer my question. What is that larva of trombiculid mite called as? Chigger mites. The larva of trombiculid mite is called as chigger mites. Chigger mites. Good. What is most common pneumoconiosis? What is most dangerous pneumoconiosis? There is a difference. Tell me. One is affecting the apex, the other will affect the base. Which is most common? Silicosis. Which is most dangerous? Asbestosis. Silicosis usually in mines, mica mines, where they are exposed to dust. That is why we are asking them to wear respirators, avoid dust as much as possible, because you will be affected with silicosis. Very, very dangerous, which can lead to mesothelioma. The two plural mesotheliomas, when you are exposed to asbestos, where you will be exposed to this cement, glass, fireproof textiles, shipyards, they'll mention this word shipyards, ground glass appearance, usually affecting the base of the lungs, lower two-thirds of the lungs. When they mention such words, it is asbestosis. Cotton mills, bicynosis. Usually the cotton spinners are affected more. Those who separate the seeds from fibers. Initially when the cotton comes to the factory, those who are separating the seeds from the fibers, spinners, they are exposed to the dust more. Bicynosis is more common in cotton spinners. Cardboard paper mills, what is that sugarcane waste related disease called as? Cardboard paper mills, sugarcane related disease, what is that called as? Bagasosis. The fungus which grows is Thermoactinomyces saccharoi. When you are keeping the sugarcane waste like this, there are some fungus which can grow. Inhaling that can lead to bagasosis. Which of the following is not notifiable disease? Answer my next question. Which of the following is not notifiable disease? Bagasosis is not notifiable. And the thing what we ask is, use a fungicide. Use one fungicide to kill this fungus, propionic acid. Moisture should be more than 20%. If the moisture is more, the weight of the waste will increase. If the weight of the waste will increase, it will settle down. It will not come out like this. Puffs of dust will not come out. So moisture content more than 20%. Which fungicide is used to kill this fungus? If they ask, it is 2% propionic acid. 2% propionic acid. So repeat my words. 2% propionic acid is used to prevent bagasosis. Tell me true or false. 2% propionic acid is used to prevent bagasosis. Tell me true or false. True statement. ESI Act benefits you should know. ESI Act benefits you should know. Sickness benefit, extended sickness, enhanced sickness. It will go in ascending order 70, 80, 100. Sickness benefit 91 days. Extended sickness 2 years. For vasectomies and tubectomies, we give enhanced sickness benefit. 7 days for vasectomy, 14 days of leave for tubectomies. So it is 70, 80, 100. Remember like this. Sickness, extended sickness and enhanced sickness benefit. 70, 80, 100. That is the first thing. Then comes maternity benefit. How much is the leave for maternity benefit now? How much leave they are giving for maternity benefit? Answer my question. 26 weeks. 26 weeks. Any injury will be covered under disablement benefit 90%, either temporary or permanent 90%. After death, they get pension, that is dependent benefit. Don't make mistake between disablement benefit and dependent benefit. Both are different. How much is the funeral expenses now? Answer my next question. How much is the funeral expenses under ESI scheme now? As of now, I am telling 15,000 rupees. Funeral expenses, it is 15,000. Before it was 5, now then became 10. Then it is 15,000. As of now, it is 15,000. Funeral expenses. Global action plan. Remember this word, GAP. Non-communicable disease. Global action plan. The question what they frame is, I am putting all the things in ascending order so that it becomes easier for you when you read. Alcohol intake you have to reduce by 10%. Tobacco use by 30%. Remember the difference. Don't take it like this. Don't take it in a wrong way that alcohol is not dangerous, so 10% is sufficient and all. No. Don't have that imagination. 10% for alcohol, 30% for smoking, tobacco use in any form. Okay. 10% again for physical activity, we have to reduce. The question what they are repeatedly asking on this is, what is 25 by 25? Highlight this. 25% mortality we have to reduce due to all these diseases like cardiovascular disease, cancer, diabetes and chronic respiratory diseases. 25 by 25 is related to non-communicable disease mortality reduction. Tell me true or false. 25 by 25 is related to non-communicable disease mortality reduction. True or false? True statement. This was one thing. Remaining numbers you can read it later. Rule of 50% is related to which disease? Very repeatedly asked, very easiest question if they frame this. Rule of 50% is related to which disease? Hypertension. H for Hall's, H for hypertension. 50% they know that they are hypertensive. Within that 50 are getting treatment properly, and within those who are treated, 50 will have their BP under control. So 50% within that I am telling. See the words properly. 50 are aware, diagnosed. 50 are getting treatment. Within that 50 are having their BP under control. BP under control. Tracking of BP means higher BP will become higher, it will track towards like that. You will become an hypertensive patient in the future. Lower BP will be low means it will be in the normal range only. Always keep in mind, high BP, if there is a school child, if the BP is higher for his age, we have to take precautionary measure, or else the child will become hypertensive in the future. What is this phenomenon called as? Tell me. Tracking is one of the phenomenon. Tracking is related to diabetes, blood pressure. What is your answer? Answer should be blood pressure. Higher BP, obviously it will track towards the higher range only. That is why we have to take the precaution. We have to reduce it. Tracking is seen in which disease, which variable it will show. This was the question. How many steps we use for steps protocol? When you assess risk factors for non-communicable disease, there are 3 steps. There are 3 steps. First, we assess risk factors using questionnaire. Second, we use physical measurements, height, weight, waist circumference and BP. 4 things are important. Physical measurements. Blood sugar and lipid levels will come under step 3, biochemical measurements. Now my question is like this. Blood samples are not necessary. Listen to the words properly. Blood samples are not necessary to assess risk factors under STEPS protocol. True or false? Blood samples are not necessary to assess risk factors under STEPS protocol. True or false? False statement. We need blood samples because step 3 need blood samples. Health education and communication. See the words properly. Experts are sitting and discussing a topic. No specific order of speeches. Audience can take part. What is this? Like 2-3 cricketers are sitting together. They are commenting on the toss. They are commenting on RCB bowling, batting, Chennai, Dhoni will come, what will happen and all. They are discussing. No specific order of speeches. Audience, if present, they can ask the question. They can ask any question. Like why you are not playing Maxwell today. Like that, if the audience is taking part, this is panel discussion. Panel discussion. Symposium is totally different. No discussion among experts. Continuous speech will come. Continuous speech. One, next speaker, next speaker, next speaker. Totally like series of speeches. Audience, they can take part. Audience, if they are alive, means everything is fine. Radial pulse, carotid pulse, सब कुछ सही है. Audience can take part. Make this question very important. I am telling. दोनों तरफ audience present, both sides audience present, but there is discussion. Here there is no discussion. This is the difference between panel discussion and symposium. Panel discussion and symposium. No need to write in the bracket audience alive and all. That is understood. Focus group discussion. When they are sitting in a circle and discussing a topic, how they are interacting, what image is used to show the level of interaction, who is speaking to whom, what is that image called as to show the level of interaction. Focused group discussion. Sociogram is used. Sociogram is used to show any activities, how to use ORS, how to wash wound. All this will be done using demonstration. No need for, listen to my words properly. No need for, yes, role play. Demonstration is sufficient. No need to show role play for this. No need to dance in going in front of them, dancing like this. Take sugar, take salt, put it there, put it here, dance, take, yo, and all. That is not necessary. Role play is not the answer. Demonstration is sufficient. Take this like this, then you can use like that. There is a way, there is a difference. Role play थोड़ा excitement ज़्यादा हो जाता है ना, नाचना मतलब ओ हो करके नाच, that is not necessary. Gather approach. To counsel anyone, we have to follow this approach. Gather. First we have to greet them. When the client is coming, greet them. Ask what you want. Tell what you have from your side. You will be telling the options. Like when you are going to any counseling session, like if very simple, if you are going to a hotel also the same thing will happen. Server will come, they will greet you, hi sir, then they will ask what you want, then they will be telling their options in their hotel, idli, vada, sambar, kesri bath, chitrana, mosranna and all, everything they will be telling. Help the client to take voluntary decision. Don't force them. Don't tell in my hotel only idli is good, take it, then doubt will come, something is wrong. Don't force them to undergo vasectomy. Don't force them for anything. You just cut it. No. Help them to take voluntary decision. Very important. Then explain the chosen decision. Always tell them what is the procedure. What is the procedure? Then return when you have to come back. Return when you have to come back. That is also very, very important. So gather approach is used for counseling. Gather approach is used for counseling. A client related to, usually in the family planning, now we are using gather approach. Help them to take voluntary decision. Spike's protocol is different in communication part. Disclosing a bad news. Disclosing a bad news. You should know when and where to disclose that news. Directly, if you are telling that you will be having cancer, you are dying, that is not the way. There is something called as Spike's protocol. Setup you should know. Patient what he is thinking. P for perception. P for perception. Invitation is important. Whether the patient is ready for the invitation or not. Ready to receive the information or not. Directly don't throw the information. Sometimes they are not receptive. You should know when you have to disclose. K for knowledge. Tell them everything. K for knowledge. E for empathy. What you would have done in that situation. What you would have done in that situation. That is very, very important. When you are disclosing any bad news, empathy is very, very important. Summary later. This is Spike's protocol. How you will be managing. What is the course of treatment. You will improve like this. Yes, good. One good news, one bad. Good. Okay. Contraception is not at all a good news as such, but still getting vasectomy done is also not a good news. Don't take it like this. One good news, one bad news. There is no thumbs up from my side. Good. Gather is for good news. Spikes is for bad news. Okay. No. Okay, good. Listen. Next. Management techniques. Cost benefit analysis. Input is cost, output is money. Tell me, 10 rupees I am putting, 20 rupees I am getting. What is this? 10 rupees I am putting, 20 rupees I am getting. What is this? Cost benefit or cost effectiveness? 10 rupees I am putting, 20 rupees I am getting. Cost benefit. For 10 rupees I am putting, one child can be vaccinated. What is this called as? Results. There is a difference. Good. For 10 rupees, one child can be vaccinated. What is that called as? Cost effectiveness. This is more important for us. Cost effectiveness. For 100 rupees, how many qualities we can gain? That is cost utility analysis. I told that what utility value and all those things has been discussed. Cost utility analysis. How to plan the graphical plan what you are putting. Like 1 month it will take, 2 months it will take to reach that objective. Like you'll be going from point A to B, then point C, like that you'll be putting some time limit. What is this called as? PERT, arrow diagram. PERT, that time activities what they plan out. That is PERT. PERT is a type of network analysis, true or false. Next question. PERT is a type of network analysis, true or false. This will tell how much time it will take to reach that project or an objective. So we'll plan out like this, 2 months, 3 months, like that you'll be going this. Doctor is coming and observing immunization session at random intervals. Medical officer is coming and checking how interns are working. Example I am telling. First they have to check whether interns are there or not. Yes or no, they have to check first. If they are yes, then they have to do all these things. How they are working, random intervals they are coming and checking. This is called as work sampling. Very important. Work sampling to improve the efficiency. System analysis. To tell which is better based on their cost effectiveness. Which is better based on their cost effectiveness. Tell me good, yes. Cost effectiveness. So if the question is like this, listen to the words properly. What is the criteria they use in cost, or what is the criteria they use in system analysis? If I want to select 1 out of 3, if I am doing system analysis, what is the criteria used? cost benefit or cost effectiveness of that intervention. If I am doing system analysis, there are 4 interventions which I have to select. Out of that, one I have to select. What criteria you are keeping? Cost effectiveness, how much results that will give for amount of money what we spend, that is cost effectiveness. System analysis, very, very good. Last 3 slides for the session, PSM one short session. We are playing the last over of the league, one shot PSM session. Last over we need 5 runs, 1 over. 1 over we need 5 runs to score. 1 over 5 runs. Who will bat? Raise your hand. Who will be batting? Who wants batting now? Tell me. Healthcare delivery. Healthcare delivery. Sub-center, primary health center and community health center. This is 3-tier healthcare delivery system. 3-tier healthcare delivery system. Okay, in this population is important. Population is important. First one. Now tell me. Good, listen. How much population for hilly area sub-center? 3000. For plain cities 5000. That is very basic question what they are framing. Very basic question what they are framing. 20, 30, 80, 120. This is population wise. This is population wise. How many inpatient beds we have in primary health center? Answer my next question. How many inpatient beds we have in primary health center? Answer my question. How many inpatient beds we have in primary health center? 4 to 6. 4 to 6. Health workers, we have it in sub-center. Medical officer and health assistants, we have it in primary health center. So the specialist will come from community health center. ANM means female health worker. ANM is female health worker. One primary health center will be the referral unit for how many sub-centers? Next question. One primary health center will be the referral unit for how many sub-centers? Again, the answer is 6. See the population, almost it is 6 times. It is 6 sub-centers. Which sub-center will conduct deliveries? Sub-center A or sub-center B? Answer my next question. Which sub-center will conduct deliveries? Sub-center A or sub-center B? Which sub-center will conduct deliveries? Sub-center B. Less than 10 deliveries per month. It is per month. It is mentioned here. Per month. So sub-center A, B, primary health center A, B, they are classified based on number of deliveries per month. Number of deliveries per month. Very good. B for baby. Awesome. Sub-center B, B for baby. Huh? Good. You are using like entrance preparation is totally different things. Na? You have to be so creative. Your mind is so creative in entrance phase. Slowly after getting a PG seat and after getting SR shape or residency, then after marrying, then after children, slowly that level of curiosity will come down. Dire. But you have to maintain this level of curiosity. That baby mind should be there within you. Never leave that curiosity. I am telling this. Enjoy this phase. Good. Biomedical waste management. Enjoy this means give the exam, take the seat, go to the next phase. That is, there is a life, maturity should be there. Every stage is having its own entertainment part, curiosity part. Good. Biomedical waste, how many bags are there? 4 bags. Red, yellow, white and blue. So very easy to understand. Anything which is tube, rubber, plastic, where it will go? TRP. Tube, rubber, plastic. Black bag is for general waste. Anything like fruity packets, paper, everything will go in black bag. Black. Okay, good. So listen to the words properly first. Urine bags, TRP, tube, rubber, plastic, tube, rubber, plastic. Everything will go in red color. Anything which is infected, body fluids, soiled, cytotoxic things or mask, all these things, blood bags, body fluids related, human anatomical waste, swabs, something which is very dangerous, which has to be burnt. Incineration should be done. That is yellow color. Yellow color. Yes. Sharps which will lead to bleeding, blood, like when you prick it or when you cut it, you might be exposed to that sharps, like any sharp edges also, like blades. White. White. Glass, either it is broken or not broken, it will go into blue. Metallic implants, blue. Any glass contaminated with cytotoxic waste, where it will go? Any glass which is contaminated with cytotoxic waste, where it will go? Blue cardboard box. Cytotoxic waste, yellow. Yes. Don't make that mistake. Cytotoxic waste, yellow. With cytotoxic waste, it is yellow, CSK. Green is not used now. As of the guidelines, it is not there. Red, yellow, white, blue. Red, yellow, white, blue. Disaster management. What are the questions which they are framing on disaster management? Before disaster, we do 2 things. After disaster, we do 3 things. Response phase, we do triage. Always keep in mind. Which color is given highest priority? Which color is given least priority? Answer my next question. Which color is given highest priority? Which color is given least priority? Red, highest priority. Black, least priority. Moribund states. Moribund states. So that response phase, triage will come under response. Reducing the risk factors, like you are building some buildings which are earthquake proof, where it will go? Reducing the risk factors. Earthquake proof buildings if you are making, where it will go? Reducing the risk factors to avoid further damage, where it will go? Mitigation. Good. You are removing all the risk factors to reduce the damage, that is mitigation. Before any floods, if you are doing any mock drills, if I frame this question, mock drills you are making, you are training all the health workers, you are training all the police officers how to manage a disaster, like mock drills you are conducting. Mock drills you are conducting, it will come under preparedness. Mock drills will come under preparedness. So these are the questions on disaster management. Triage, colors, match the following. Priority, what is triage based on the survival pattern, and what is mitigation to reduce risk factors to avoid further damage, and what is preparedness. Mock drills will come under preparedness. So fine, we have finished the one short session of PSM 2024. We tried to cover all the important topics which are important and which can be discussed in one short session.
Alright guys, so I hope this one shot program was very useful for you, है ना? So can I say that the entire subject was revised in a very quick amount of time? But as I told you earlier, this is not the end. Now what you have to do is, you have to attempt the test. And how will you attempt the test? You have to download the eGurukul app if you have not done it. And in this eGurukul app, go to the test section. In the test section, go to the QR test. And in this QR test, you will see the test of this subject. Click on that test. Gallery or camera. They will ask for a QR code, and here is the QR code. Scan this QR code or download it and put it into your gallery, whichever option that you want, and you are good to go. Please make sure that you are not finishing your day without attempting the test. I wish you all the best for the test as well as happy reading, and I am sure that you will reach to the success in the exam ahead. Take care and God bless you all.